Welcome to Healthcare Matters, where we explore important topics shaping the future of healthcare. This episode is specifically important as we are recording in the Breast Cancer Awareness Month. Today, we are focusing on breast cancer care and how the multidisciplinary team approach, the team-based approach, can make a significant difference for our patients. We are honored to have Associate Professor Assia Konsulova. She is a senior medical oncologist and leading expert in breast cancer care. She has extensive experience across multiple centers in Europe and in Bulgaria. She is also a strong advocate for women in oncology. Welcome, Dr. Konsoulova. It's wonderful to have you.
Thank you.
Let me start by asking you, how are you today?
Thank you. I'm great. I had a very busy day with many patients. Most of them, by the way, were breast cancer patients. We had very positive results that really bring motivation to all of us. So it was really a hard day, but eventually very good day. So I feel fine. Thank you.
It's great to see your smile and your optimism, and this is really contagious. And I would be curious to know more about your journey as a doctor. Would you tell us more about your journey and how interacting with different specialists have shaped your passion, your interest in breast cancer care?
My journey, now that you ask me, it takes a while, that journey. So a journeyman, a very nice song I remember now of Iron Maiden. Well, I started in Varna and there was no free position. So I had to start with a PhD thesis writing, but I was not working as a physician. So it took me a while. It was in the times where young people to find work and start working was very, very hard. And I won a scholarship to go to Brussels, to a university, where I managed to integrate into a team that was mostly dedicated on breast cancer. And when you see inflammable people and when you're young, that's so nice because you really get inflamed about breast cancer. And what I learned there was something really crucial, that was something that was not very typical for Bulgaria, that breast cancer care is very different from what breast cancer treatment is. And as we were just studying and teaching what breast cancer treatment is not breast cancer care. And afterwards, with the time, you start to realize that caring for patients, it's not just caring for their disease, but caring for the patient itself. And with the time, you meet many people that are great people, that show you what is your role, what is your goal, and how you can do better. And that if you lose an hour today in reading something new, finding something that might be better for the patient that you just saw, it brings a lot of confidence and it makes you feel happier. You also get a better member of the team, so the team goes forward and you get better success stories, which makes you even more motivational, and with the time you get also experience. So that's very good. And what I saw in those centers where I worked, there are just 3 of them, but you see that those are teams. So you grow up as a team and everybody in the team is always giving you a hand. And being the youngest might be something beneficial. Sometimes it's a bit hard, but you see that when you evolve in your career, you get better and you evolve with the entire team. So it's really important to grow up into a team, to have a mentor, of course, who supports you and might sometimes show you which might be more important decisions, for example. And basically that's it. I had the possibility twice to stay definitely in another country, but coming back, working home for our patients and being better for our patients is something that is worth doing. So I keep having my personal life and personal career here in Bulgaria, and I'm very happy for that.
Great. You had this gift of life to work with different cultures, and you mentioned a lot of people, and you mentioned also teams. So maybe that will take me to my next question, because we hear a lot about teamwork in healthcare. So my question to you, why this is very important in breast cancer to have different specialists working together, this approach known as multidisciplinary team. Why this is important in breast cancer care?
Multidisciplinarity is important in cancer care in general, not only in breast cancer, and it is so essential. You can grow up your knowledge in some areas, but you cannot grow up your knowledge in many areas. For example, radiotherapy, surgery, or some kind of diagnostics. And working with colleagues who look from different point of view enriches your point of view as well. I cannot do surgery, I cannot do imaging diagnostics, but I see what my colleagues are capable of, and I can also bring them the idea about the patient. So being centered around the patient, it really makes a team decision where everybody gives their best, because my best is not in the area where the other best of the other person is. And by being together, today we just had an MDT in breast cancer, we had 2 MDTs, and for some patients you keep discussing for many minutes and times just a very simple small step, because this is important. It's the disease, the patient, the conditions, the disease biology, so you need many clever heads to think alike by wanting to give their best and thinking at the same time for the best of the patient. So multidisciplinarity is not just a paper that you need to have to go for the treatment. It's a decision in any time point, and when you sit around the round table, it's always better to have a very clever decision. I just want to share something that I had yesterday. I had a very typical patient with breast cancer. So it's the road of that patient, the pathway is more or less clear what is going to happen, but she had a very specific comorbidity that I just mentioned, and I had a very bright young colleague suggesting an additional diagnostic tool, which I was not that much thinking into that direction. And it really made a very clever decision plan just by adding an additional comment, an additional young, bright head who really helped the entire team to manage better the patient. So multidisciplinarity is really, really essential in cancer care.
So multiple clever minds working together in a super patient-centric, and this example is really
sounds
also...
good. Now that you say it, sounds
yes.
great. It's really great, and it exists. It used to be something that is a bit more, just have it as a signature on a paper in Bulgaria, but we start to do this in Bulgaria really more and more often in many cancer localizations, in many cancer centers, which brings us to take better decisions for the better results for the patients.
It's definitely encouraging to see it more and more in Bulgaria. And I like that you had experience in different centers across Europe. And what are some of the biggest challenges that we are facing today in Bulgaria? And how do you see those challenges versus your experience in Europe?
In Bulgaria, we work by clinical packages, ambulatory procedures and stuff like this. These all sound like multiple steps that are like sequential ones. But the patient does not only need one step or another step. The patient needs real multidisciplinarity at the same time. For example, in Bulgaria, breast cancer diagnosis can be done via true-cut biopsy, done only by a surgeon if it has to be reimbursed. It cannot be done by imaging diagnostics, which is all over the world. So being just focused on a specific step that can be done in one only way, I think is something that needs to be broadened, because the patient might have different types of biopsy under ultrasound control, vacuum-assisted biopsy, or in the operating room. So we have different ways to do one thing. And by having those boundaries, just to have one thing done in only one way, it's something that leads to a delay in the entire diagnostic process. I think that this should be optimized, because this also a bit obstructs the real multidisciplinarity. Okay. So allowing the multidisciplinarity in real time. It's not a clinical package or an ambulatory procedure. It's the entire process that can be done differently. And also, I think something that is also very important, we have to have centers, cancer centers, so comprehensive cancer centers. Those centers can prove their quality. And in Bulgaria, many times quantity is being measured, but it's not quality. Survival, registries, those things, they have to be they have to be more largely implemented because we have so much data, and losing that data in order not to analyze them and get better, this is something that we lack. The measurement of quality, the comprehensiveness of care in Bulgaria, and a certification of cancer center that might prove that it can, and there are people inside working there, they can do the entire process, diagnostic and treatment, as in any European country where they have the comprehensive cancer centers, for example.
Definitely those are some tough challenges for sure, but usually tough challenges also push us to get to some brilliant solutions. So also from your experience, what can be done to change the approach further in terms of breast cancer care in Bulgaria?
We do many things quite well. We have some abstractions because we need a bit more people to be specialized, for example, in breast cancer diagnosis, imaging diagnostics, for example, to have a center where you have the comprehensive images and diagnostic, not only have an ultrasound and mammography, but have the MRI as well, have the possibility for different types of biopsy. So having that comprehensiveness as a breast cancer center is something that is really, really essential. And this is not new. This exists all over Europe. There are many centers that function like this, and they are, again, centered around the center. One very interesting thing is that in some of those centers, you have the so-called horizontal structure. So you have the surgeon, you have the medical oncologist and radiotherapy who work in the same ward. So they are guided by the medical oncology most often, but they have the same purpose. It's not a different word just by separating people into different areas. But the work is a team, is an MDT, that is just like you and me talking. You have your bureau next to mine, and we manage the same patient at the same time. So having this as breast cancer care and center is something that I think we need to do in many cancer localizations as well.
It will create definitely a big value for our patients and elevate the quality of the care. So yes. I'm curious also if you would like to ask me any questions as well.
There are so many questions that arise. We were thinking that I'm thinking frequently, we try to approach Europe. So we say that we have to fill in the gap. And Europe doesn't wait for us to come. So there are many projects, plans, initiatives, for example, European Beating Cancer Plan. So do you think that those are really can be also implemented in our country? What is your view on the National Cancer Plan as well? Or also, I think something very essential is, do you think that we are getting better in breast cancer care, for example, in the diagnostics, in the all those personalized medicine that we do in Bulgaria? Because you have an overview on the entire world, and what do you think, how are we doing here in our country?
I believe initiatives like European Beating Cancer Plan are really crucial to our approach to support cancer patients either in Bulgaria or across Europe. I felt personally very proud that we have also our Bulgarian version. So we have also our Bulgarian Beating Cancer Plan, which was a great milestone. I believe now we need really more energy behind the execution, because the original intention from such a plan was really to raise awareness, to allocate resources, to really drive more attention to research and development. So we need to put more energy in terms of execution, take it to the next level, have a clear budgets and projects, because ultimately such a plan can help in terms of early detection, in terms of diagnosis. And what we see today that there are certain challenges, like the cost of those diagnostics are high if you just leave it to the patient to pay out of pocket. Also, we have a limited number of healthcare professionals if you think about trained pathologists for those continuous change in diagnostics, and definitely the infrastructure and equal access for the patients. So I believe here we have a great opportunity because we have already the strategy and the vision, but we need to work together, I mean, as payers, as policymakers, as healthcare providers, as industry for sure, the whole ecosystem, to really have more energy behind things like early detection, reimbursement for diagnostics, ensuring access to innovation, and finally, as you nicely mentioned, really measuring what really matters. How we measure those outcomes for our oncology patients. I think also more energy and effort can be there where we measure things we care about, like survivors and other clear measures in oncology.
Yes, we have lots of things to do, including a screening, as you said, so the entire comprehensiveness of cancer care, I think we should implement a bit more in our country.
Definitely, yes. Screening is a big thing, and you talk again in your thoughts and reflections about time and how time can be important. I think screening timely is very important. Diagnostics, access to proper diagnostics will change the face of diseases like breast cancer.
Yes, but we're getting better. Those things are happening. It's not all over, but it's really something that is evolving, and I think it's starting to function better in many centers. So I hope we can manage to do better next year, for example, as well.
We
Yes.
always hear inspiring stories that, as you said, versus 10 years back or 2 decades, we are really improving in terms of survivors and other things. And it's great to have leaders like you are fighting for the patients and to have a better healthcare system also. I'm also optimistic, so joining your side. Maybe as we are going to the closing of this episode, I would like to wrap up asking you, as we are now will be in the Breast Cancer Awareness Month, but as you know, moving very soon in November to the Lung Cancer Awareness Month. So what are some of the lessons or reflections that we can take it forward, to lung cancer? Especially we spoke a lot about things like policy changes, screening and diagnosis.
First, for me, November is always related to prostate cancer, but many people relate it also to lung cancer, of course. So it's interesting. So in lung cancer in Bulgaria, I think we should promote the healthy lifestyle. We should promote quitting smoking. And smoking cessation is not very popular in Bulgaria. I think this is very essential. Also, as in breast cancer, I think we need screening. Many countries, they have screening for lung cancer. This is also something that I think we can do and also promote as mentality. We are not thinking in advance. We're not thinking of screening or early diagnosis. We again immediately speak about the diagnosis and the treatment. So lung cancer is also a challenge for us, but it has changed a lot. Now we have so many new treatments, and we have the precision medicine. In many countries, we have the diagnostic with the, for example, next generation sequencing. Next generation sequencing. And we have the possibility to personalize the treatment for every patient. Okay, it's costly, but it's effective. So I hope we live in a world where we can give the right treatment to the right patient by having the right diagnosis. And this is very crucial because lung cancer changed as well. Lung cancer now we have so many patients living for so many years, we have cured patients. So probably being positive, looking for early diagnosis and a better diagnostic and better personalized treatment for lung cancer is something that I hope will also be happening more frequently.
Thank you so much. It was really very insightful. Thank you also for the optimism and the smile. Personally, I found it very interesting how we moved across almost the whole journey of our patients, speaking at the very end about the prevention and how things like smoking cessation can help in preventing lung cancer and other things. A lot of insightful also discussion around the screening, and we have seen significant improvement in the way we take care of our breast cancer patients. And also we talk about diagnostics and proper access to diagnostics using things like next generation sequencing, personalized medicine for our patients, and definitely at the very end, outcome tracking, measuring what really matters, because healthcare matters.